Hi, this is my teaching. This is my teaching handout presentation. Roxanne DuPaul, and I'm talking about coping with chronic pain through guided imagery. First, a discussion on a recent news article in the Canton Repository, where I live near Canton, Ohio. The article is titled Deadly Synthetic Drugs Driving Stark County's Overdose Spike. This is a summary of what the article discusses. Carfentanil is such a powerful drug, an amount smaller than a grain of sand can kill a person. This opioid first hit Stark County this last July and caused overdose outbreaks across Ohio last year. This drug is an elephant sedative that is being mixed with cocaine and heroin and other opioids. Carfentanil has been confiscated and multiple drugs seized by police in our area. According to the Assistant Stark County Prosecutor Fred Scott, the fentanyl and the carfentanil are the two that we see, and they're lacing the heroin with those. He goes on to say heroin is deadly in and of itself, but when they lace that with extra drugs, that's what's causing the overdose deaths. The number of fatal overdoses went from 75 in 2015 to 118 last year. Canton Repository analysis of the 2016 overdose deaths showed 85 involved heroin, carfentanil, or fentanyl cases, according to the Stark County's coroner office. Fentanyl, an opioid 50 times stronger than heroin and 100 times more powerful than morphine, was linked to 64 deaths, the most of any opioid. Heroin was linked to 26 deaths, and 13 overdose victims tested positive for the drug, which is 10,000 times more powerful than morphine. Fentanyl and similar drugs are cheap and easy to mix with other substances, but their potency makes them dangerous for police, paramedics, nurses, others who might be exposed to them. According to Canton Police Lieutenant John Gabbard, we have to be a lot more cautious, obviously, because the stuff is deadly absorbed through your skin or breathed in. Just a huge epidemic in especially Canton area. This drug is affecting my facility because we are within Mercy Medical Center in Canton, and we take long-term IV antibiotic patients. Over the last 2 years, we have had multiple 18 to 25-year-old patients that developed abscesses and severe infections from the use of heroin and other narcotics. They lead high-risk lifestyles that make them a challenge to care for. Our usual patient demographic was mostly vent patients, cardiac drips, just that type of patient. But what we're seeing now is more and more of the high-risk lifestyle type patients. They're challenging to care for. The people that visit them are bringing them drugs into the hospital. Patients are overdosing within the hospital on street drugs that are brought into them, and we have very little ability to combat that or prevent that. Recently, we had a 21-year-old that was hospitalized for abscesses that formed within her lungs and her left wrist and elbow. She tested positive for heroin and other narcotics on admission. She had a surgical incision and draining of the abscess area in her left arm, and she needed long-term antibiotic therapy, which is what brought her to us. She was having severe pain, and due to her use of illegal substances, doctors were reluctant to prescribe her any opioid-based pain medication. So she had her boyfriend bring her needle and vial of heroin into the hospital, and we found her in her bathroom in her room with a needle in her arm, overdosed. So that's an issue that we've been dealing with recently. My target audience, though, is long-term acute care patients with chronic pain. Often these patients are prescribed higher and higher doses of opioid pain medications because of the tolerance that they build up over time. In the LTAC setting, long-term acute care, patients stay up for up to several months related to chronic illnesses. In my experience, early detection of Chronic pain with more holistic approaches could possibly alleviate the need for opioid pain medication prescriptions. Most physicians are quick to prescribe medications like morphine sulfate, IV, or IV Dilaudid for even minor discomforts, as opposed to choosing lesser drugs like acetaminophen or ibuprofen. Obviously, the exception is when it's a drug-seeking patient, like I described earlier. Even less frequent are the physicians that are willing to try a more holistic approach, like guided imagery, to relax and control patient pain. Using guided imagery for pain control would be an approach that many of my LTAC patients would consider. Most patients do not want to initiate the use of opioids for fear of addiction. These are the patients I would like to focus on for guided imagery. My goal is to increase the patient's ability to control their own pain without narcotic use. My teaching goal is to take a patient and teach them an alternative to opioid pain medication. The practice of pain management has expanded over the last 150 years, from the introduction of opioids, advances in surgical interventions, and the introduction of electromedical devices. Even with these advances, only 25% of patients with chronic pain do better after 1 year of treatment. Pain management physicians may have to look beyond the conventional medical toolbox to help patients cope with their chronic pain. Guided imagery is one of the areas of alternative treatment options for chronic pain. I chose guided imagery because almost everyone has had a bad headache or a twisted ankle and can relate to what pain feels like. Patients with chronic pain have to deal with pain that never goes away. If you haven't had to experience this, it's very difficult to understand. Pain affects your ability to work. It affects relationships with family and friends. Pain affects your ability to enjoy the things that you like doing. Chronic pain is a challenge physically, mentally, and spiritually. The use of guided imagery is an attempt to influence perception by directly altering sensory, cognitive, and affective brain activity associated with imagined content. In connection between mind and physical health, that connection has been well documented and extensively studied. Through guided imagery techniques, patients can learn to control functions normally controlled by the autonomic nervous system, such as heart rate, blood pressure, and respiratory rate. One of the biggest benefits of using guided imagery as a therapeutic tool is that it is available to be used anywhere at any time. Guided imagery can be self-directed or directed by others. The teaching pamphlet that I have provided can be used by the patient themselves or by someone directing it for them. The first component of reaching relaxation is through breathing techniques. This is the pamphlet, and I have a link to it. Again, the first component of reaching a state of relaxation is through breathing techniques. Deep breaths in through your nose and out through your mouth. A patient is directed to find a comfortable chair or sofa to sit on or in their hospital bed. They are asked to loosen clothing or take off any shoes if they have any on. They are asked to clear their mind of all their worries. During the initial phase, the patient closes their eyes and focuses on the slow in and out sensation of breathing, in through your nose, breathing out through your mouth, imagining that with each exhalation, they are releasing pain and tension from their muscles. Once relaxation is complete, it's time to focus on the imagery or the visualization itself. Herein, then is with, again, the education pamphlet. So to begin with a patient, imagine with each breath in, you're breathing in warm, comfortable air. This is the guided imagery part. With each breath out, you are releasing all of your aches and pains. Imagine you are walking along the edge of a pool of water. As you look at this pool, you will see shades of blue along with a special white glow coming from within the water. Imagine stepping into the water up to your ankles. The water is warm, comfortable, relaxing. As you walk deeper and deeper into that pool of water, you notice that the warm white glow within the water is easing tension and numbing pain. Higher and higher the water reaches until you're up to your chin. Your body's warm, numb, relaxed. All the tension has been washed away. Stay within the warmth of this water as long as you need to. When you feel ready, slowly turn and begin walking out of the water. You are feeling comfortable and relaxed. Imagine the special white glow remains on your skin. It continues to bring slight warmth and numbness to your skin. Imagine there's a fluffy white towel by the side of the pool. Pick it up and dry yourself. Count backwards from 10 to 0. 10, 9, take slow breaths, deep breaths in and out. 8, gently wiggle your fingers. 7, gently wiggle your toes. 6, slowly open your eyes. 5, you are feeling relaxed. 4, you're feeling comfortable. 3, your eyes are completely open. 2, you feel refreshed. 1, you're now ready to start your day. Hopefully that leaves the patient feeling relaxed and feeling a sense of control over their pain. This is just one example of imagery, but the patient can personalize the images they use. Everyone has their own special personal happy place that can be used to provide comfort and relaxation. Each person can have their own tailor-made version of healing imagery. Thank you.